Chair recognizes Mr. Stanley of Waltham.
Mr. Speaker, and through you to the members, today it is my privilege as House Chair of the Aging and Independence Committee to rise and speak in support of House 4706, an act to improve Massachusetts home care. Mr. Speaker, the Commonwealth's continuum of care for older adults, the spectrum of long-term services and supports, LTSS, is designed to meet the needs of those who are no longer able to care for themselves due to declining physical, cognitive, or mental health. While older adults and individuals with disabilities may receive LTSS in a number of settings, the three main areas of our continuum of care are home care, assisted living residences, and nursing homes. Mr. Speaker, thanks to your leadership last session, we passed the historic long-term care bill, which made the first major changes in a quarter century to our assisted living and nursing home industries. And now, Mr. Speaker, again, thanks to your leadership, the House is poised to make significant changes in home care. This legislation establishes a licensing process for home care agencies which will improve standards and protections for home care workers and consumers. Mr. Speaker, I would like to thank you and your team for prioritizing home care licensure in the House and supporting the efforts of the Aging and Independence Committee to develop this legislation. I also appreciate the advice and guidance of the House Ways and Means Chairman, the gentleman from the North End, as well as House Counsel in preparing House 4706. Home care refers to the range of non-medical services consumers receive in their own home, including assistance with daily tasks like bathing, toiletry, and meal preparation. Other household tasks like laundry and grocery shopping, and also companionship. These are critical services that help older adults age in place, maintain their health and well-being, and avoid unnecessary and expensive ER visits and hospital stays. For many older adults and their families, home care is the preferred choice of keeping loved ones in the community and out of the institutional settings to help them remain independent and close to family and friends. Aging in place helps to preserve social connections and prevent loneliness and social isolation. Home care is more affordable than paying for assisted living or a room in a nursing home. The Commonwealth recognizes the benefits of home care to older adults' health and well-being, including savings from delayed or prevented nursing home stays, and the strong desire of our aging population to remain in their homes for as long as possible. We have the state's home care program, which provides care management and coordination, advocacy and education, and in-home and community support services for adults 60 and over, people with disabilities, and people under age 60 living with Alzheimer's disease or related dementia. We also have a number of home and community-based service waivers, or HCBS waivers, to help keep Mass Health members in the community. Since the pandemic, we have dedicated more funding to helping home care workers earn a living wage. Despite the Commonwealth's strong history of supporting policies that promote aging in place, there is no oversight of the growing private pay home care industry. Under the home care program, home care agencies that contract with Aging Services Access Points, or ASAPs, to provide home care services are subject to contractual requirements and oversight by both the ASAPs and the Executive Office of Aging and Independence. There are no such standards for private pay home care agencies, leaving both home care workers and consumers vulnerable to bad actors. There is a saying that people don't know about home care until they need home care. When consumers seek home care services through an agency, it is often during an emergency. I experienced this myself. You don't have time to conduct all the research like you ideally would when buying a car or a laptop. You need help, and you need it now. Bringing someone into your home to help with some of the most personal tasks of our daily lives is a significant adjustment, one made worse if you have to cycle through multiple agencies until you find a good one that actually provides quality care. This is especially important for family caregivers of loved ones with Alzheimer's disease or another dementia. The caregiving burden can be much more demanding for these families, especially when loved ones are in the later stages of the disease. Many rely on home care workers to handle some of the caregiving duties they no longer can provide. Mr. Speaker, during the public hearing for this legislation, the Aging and Independence Committee received testimony from a husband whose wife was diagnosed with Alzheimer's disease 5 years ago. She required 24/7 around-the-clock attention. The husband relies on home care to assist his wife with toiletry, bathing, and dressing. They went through half a dozen caregivers in a 9-month period before finding someone who possessed the basic training on working with an individual with Alzheimer's disease. This home care worker understood the importance of routine, which helps individuals with Alzheimer's retain certain skills like putting your shoes on. For example, this worker made sure his wife was taken out for walks each day. This routine helped the wife, his spouse, remain engaged with putting her shoes on. A basic but important task. This home care worker also understood the importance of nonverbal clues for communicating with individuals with Alzheimer's. Instead of just verbally communicating when it was time for the spouse to put her shoes on, this home care worker also touched the wife's foot to indicate that it was time to put her shoes on. Mr. Speaker, with no minimum standards in place for this type of training, consumers do not know what they are getting. I can't imagine the stress consumers like this husband went through when they have to switch home care agencies and workers multiple times. Mr. Speaker, over 30 states have a licensure process for home care agencies. Massachusetts does not. As a result, it is impossible to know how many home care agencies are currently operating in the state. After several years of competing proposals, the Home Care Licensing Commission was formed back in 2021 to bring stakeholders together and find consensus on this important issue. I was appointed to this commission not long after being named chair of the Aging and Independence Committee. This ended up being a blessing in disguise, as I thought I had a good understanding of home care. I was wrong. Being part of the Commission's deliberations quickly brought me up to speed on the status of home care, of the home care sector. Following the release of the Commission's report, my office worked with the stakeholders who also were members of the Commission to incorporate the report's consensus recommendations into the legislation before you today. We worked with the Home Care Alliance of Massachusetts and Home Care Aid Council to ensure the requirements under the bill do not overburden home care agencies, especially smaller providers, and increase costs for consumers. I'm grateful for these organizations' partnership, as it is very rare for industries to come before the legislature and request to be regulated. That is how important home care quality is. We worked with Mass Aging Access to ensure there was no duplication between the licensing requirements in the bill and the current vetting and oversight requirements for home care agencies participating in the Commonwealth's home care program. So what does this bill do? The bill grants the Executive Office of Health and Human Services the authority to find and administer other penalties to home care agencies for non-compliance, work with Executive Office of Aging and Independence and the Department of Public Health on surveying and investigating home care agencies to ensure compliance with licensing standards, conduct a suitability review of licensure applicants, including all individuals with 5% ownership in the home care agency, the same threshold for nursing homes and assisted living that was established in the long-term care bill. Equity firms are looking for safe harbors. With the oncoming recession that we're most likely probably in or may become in soon, home equity firms are looking for recession-proof industries. Mr. Speaker, we learned the hard way last year how destructive private equity can be to our health system with the Steward bankruptcy. This suitability standard review is important for the state to know how much of a presence private equity has in home care. To improve transparency, this bill also establishes standards for service plans and contracts that consumers sign onto with home care agencies, and including a detailed description of services, total cost of care, and total information for the home care agency. Minimum standards for home care agencies would also include coverage of workers' compensation and liability insurance, and providing adequate equipment and supplies to home care workers. We also require agencies to conduct background checks for all home care workers and provide them with sufficient levels of training, including how best to care for consumers with Alzheimer's and dementia. Mr. Speaker, one of the biggest takeaways from my time serving on the Home Care Licensing Commission was how important it is to bring stakeholders together where there is disagreement. This legislation creates the Home Care Oversight Advisory Committee that will guide the development and implementation of the home care licensing process. This ensures these stakeholders continue to work together and have a formal role in the regulatory process. Mr. Speaker, this legislation also recognizes the critical need of ensuring our home care workers have a safe working environment. The majority of home care workers are women of color, and immigrants. While caring for older adults and individuals with disabilities can be highly rewarding and fulfilling, it is also grueling work. These dedicated professionals cannot perform this work safely and to the best of their ability if they are being harassed by consumers, their caregivers, or fellow home care agency staff. This bill creates the Home Care Worker and Consumer Abuse Stakeholder Advisory Committee to study and recommend standards for addressing abusive treatment of home care workers, PSS, personal care attendants, and home care consumers. This home care bill also extends anti-discrimination protections to PCAs to ensure these workers do not have to work in a hostile environment. Mr. Speaker, the demand for home care services is expected to increase dramatically as our aging population continues to grow and the number of family caregivers continues to shrink. The U.S. Census Bureau estimates that more than 25% of our population in the Commonwealth will be 60 or older by 2030. This is a 33% increase since 2012. For the first time in history, more people in Massachusetts will be over 60 than under the age of 20. At the same time, the U.S. Census Bureau's caregiver support ratio, the number of people providing care versus the number of people in need of care, will be reduced nearly in half by 2030. These demographic changes underscore the urgent need for this legislation, as more adults will rely on home care not only for their long-term care, but as respite for their family caregivers. Many families want to care for their loved ones at home, but must balance full-time work, children, and more. This is where home care agencies play a major role in filling these caregiver gaps, assisting with daily routines, including bigger tasks like bathing and dressing. This support allows family members to keep their loved ones at home while balancing their busy lives. Overall, this legislation will help give families the peace of mind that home care agencies they hire and home care workers coming into their home are held to the highest standards. In closing, I want to thank my talented staff, the Aging of Independence Committee members, the stakeholders we collaborated with in developing this legislation. I also want to recognize the ongoing passion and hard work of our ASAPs, the Executive Office of Aging Independence, and the many home care workers, home care agencies, and home care workers who are all dedicated to caring for the aging population. High-quality home care is critical to keeping our most vulnerable independent, to supporting family caregivers, and to our economy. Therefore, I ask for your support for this measure, and that when a vote is taken, it is taken by the yeas and nays.